So hi everyone, this is the Ben and Gary Show. We know dentistry, and we always are answering questions of our I guess our viewers and individuals who want to know a little bit more about their smile. Almost like a free consultation here over a video is what I think we're really up to. And one of the things that was kind of come up, which I think is a really good question. It seems so simple here, but in this day and age when individuals are coming to us trying to be more of an advocate for their own health,
Right.
they want to know what are the kind of questions, if I were a dentist, what kind of questions would I ask my dentist when I go for my next dental visit. And I thought that was a brilliant question, so that they can get the kind of information that they're looking for. And so I think to answer that, I would break this down into about 4 different areas I think are important questions. Number one question is, should I be seeing the dentist, or should I be coming more frequently than, say, twice a year? Gary, how would you respond to that, to someone?
Well, actually, most patients, the average patient, really only needs to come in twice a year to have their teeth cleaned by our hygienist, our very well qualified hygienist, I might add. But that's basically to have their teeth cleaned, make sure their gums are in good shape, and then when we come in, we just check to make sure that the teeth are also in good health. So I think that's the standard answer that I'd give to for the most part.
Sure,
but there are exceptions.
There are definitely exceptions, and I think that for my perspective is that individuals who have had lots of restorations in their mouth, have had crowns in their mouth for 10 years or more. Perhaps have gotten a little longer in the tooth as they've aged and had some gum recession. More of your tooth is going to be exposed to what's in your mouth. And if you're not one of those individuals who is adamant about being able to take care of their oral health, to floss at least once every 24 hours to disrupt that bacteria that might be laying on your tooth, it allows everything in your mouth to work to actually attack your teeth even that much more. So I would actually advocate that they need to be in more than twice a year. I would actually recommend every 4 months, which is essentially 3 times a year. So that's how I would actually approach it here. And I think those who are every twice a year may not fall into that category of the things that I just mentioned, and they can actually do well with just twice. The next question that I would want to ask, is that, do I grind my teeth? Is the next question I would want to ask my dentist. And how do you sort of respond to them like that in terms of what are you going to look for?
So during a evaluation, when you're in for your cleaning, we would look at any wear patterns that have occurred on the biting surfaces of both your back teeth and your anterior teeth or your front teeth. And oftentimes we'll find and by wear facets, we'll see like flat spots that develop,
burnish, very, very shiny areas on their teeth.
But on the front teeth, we'll notice that the enamel right on the incisal edge, or the lower edge of your upper front teeth, and the upper edge of the lower front teeth will look worn. You'll start to see
worn. The enamel thicker at the edge instead of really nice and sort of knife edged.
So all those little mamelons, or the
little ridges
that you saw, if you look at your young children's teeth, you'll see that they've got a little scalloped pattern on the edge. Those will all be worn down, and so that's what we look for, is just any wear patterns. Sometimes when people are asleep, they'll have these nocturnal habits where they'll just grind their front teeth.
And
other
squeeze.
People focus on their back teeth, and so we'll start to see wear patterns develop over time.
Over time is right. Sometimes we, even as the dentist, you'll see right at the gum line, we'll see little areas that have almost been notched out, it looks like almost like you took your toothbrush and sort of sawed off part of your tooth right at the gum line. Well, that also too comes from the fact that you can clench and grind your teeth, and that those notches can develop because of the amount of force that you place on them. And that's when I would say, honestly, at least in this area here, we're in Washington, D.C., where there's no stress, no traffic jams. Just kidding. Almost everybody's, I would almost say, could really benefit from a custom night guard.
Right.
And the purpose of that really is your teeth can grind against really can't really tell you to shut that grinding off.
Right.
It's usually someplace up in your brain that's telling you to do that. Kind of hard to find the switch for that. So let's put a piece of customized plastic between your teeth that you can grind against and not wear your own natural teeth down. We can always make more plastic.
Right. Exactly.
Another question I think that really is important there, and this can be a life or death kind of situation, and it can really save your life, is do I have oral cancer? Is another question I think you should be asking. And for us, I think every exam, that we have, every hygiene exam, we are looking to see if there are changes. I think that, that's another, thing that we need to do.
It's so important.
So important. There's so many cases of oral cancer that are becoming, coming, patients or people will have in the United States, and it's becoming far more prevalent. And so, the importance of being able to diagnose that early, which it's possible to do. Oral cancer is you can certainly survive it, but the longer you wait, the more that you don't see the dentist, and the more you ignore signs and symptoms, it can really be a really challenging position to be in.
Right. So what I like to tell my patients is, if they notice anything that any type of lesion, ulcerations, that lasts or linger longer than 2 weeks, to have it, come in and have us look at it.
Particularly up under your tongue, base of your tongue.
It could be anywhere, really.
Back in the throat here. It could be anywhere. It's more likely that it's going to happen there than it is, sort of on the gum tissue.
Right.
But certainly if you notice any difference in swallowing, it feels like something is in the back of your throat for a period of time, particularly with the prevalence of the HPV virus, that is being seen as a tremendous link between that and oral cancer. And if you have other risk factors that are going along with that, like smoking, heavy drinking, and alcohol, you are far more likely to be able to be to have oral cancer. You're certainly at a much higher risk for that. So make sure you ask your dentist, and if they have other techniques of being able to evaluate your mouth, that's even better for you. But for us, it's simply just a looking in the patient's mouth and being aware that there are any sort of changes on one side of their mouth versus another, or color changes to lesions in their mouth. And then I guess the last thing that you should be asking here is, what kind of toothbrush should I be using? We've covered this before, but I think that we'd like to talk about soft toothbrush.
Right. Soft bristles.
Soft bristles.
Sounds very basic, but it's important.
Be careful about the toothpaste that you use. Many of these ones, especially out there, have whitening component up to them. That whitening component is just none other than abrasive silica that's been placed into the toothpaste to make it more effective in terms of cleaning off your teeth. But at the same time, what do? You strip off your enamel.
Right. Exactly. So.
Not a good thing.
Just got to be careful about that.
Yeah. So these days here, it's hard to control like how much somebody's going to put the force on it, because of the times of day that you're usually brushing your teeth, in the morning and the evening. You're not thinking about that, and you're just kind of going at it and overdoing it. So I think electric toothbrush, good idea.
Yeah, I love mine.
I think I switched to mine a long time ago, and that way I don't have to think about it. I just sort of like move it around where I need it to be, and even have some other bells and whistles on them, like connects with your smartphone to see if you're more effective. I always think that's pretty cool. My kids think it's a neat thing. So I think those are the ones that I would want to make you aware of, and just to kind of recap that is like how many times do I need to have my teeth cleaned is a great question. The next one is, do I have oral cancer? And the other one, what kind of toothbrush should I be using? And grinding. So those 4 things, remember those. Talk to your dentist next time. At least get there twice a year. This is the Ben and Gary Show. We know dentistry. We'll see you next time.
Bye-bye.